Hi, everyone. We started talking about what is public health. I posed that question, and most probably with a series of videos, we'll try to respond to that particular question in a bunch of different ways. Today, I'm going to talk about decision making. Particularly, we're going to speak about how we make decisions in health sector. So, on what these decisions are going to be based. Are these decisions logical, political, based on economic parameters, and so on and so forth? Well, first, let me give you just one simple example. Imagine you made a decision to start a business, a car dealership, okay? Imagine you're going to import, say, cars to a country which does not produce its own cars. So, what are you going to do? Will you immediately bring in, say, 100 cars and start selling them? Of course not. What most probably you will do, you'll do the marketing research. In other words, you will design a questionnaire and will conduct a survey. So, to find out what kind of cars are favored, like the used cars versus new cars, like the full-size sedans versus uh, hatchbacks or SUVs or whatever. And also, what matters is the colored cars, right? So, for instance, if you decide to import the black-colored cars into the very hot countries, you're not going to sell them because of the average temperature is high. So, can we translate that logic into public health and into health sector? Yes and no. I've seen on many occasions when major decisions in public health have been made because of certain political implications. So, but on the other hand, in public health, we have a very strong, instrument which uses existing evidence. And we have two big tools in public health then to uh, base our decisions on. The one is demography, and the other one is epidemiology. So, demography, among different things, deals with recording the characteristics and trends of a population over time. And I want to remind you that health sector is there to serve the population. So we have to know what are the needs of the population, what is the size of the population. While on the other hand, the epidemiology deals with the quantification of the extent of disease, its patterns of change, and the prevalence of risk factors associated with the disease. And it also deals with the causes, distribution, control, and outcome of disease in the population. So today I'm going to concentrate on epidemiology. It's a very, very powerful thing, and it is not that complex as the people who might not be related with epidemiology, envision it. It's very useful and quite straightforward. So I'm going to explain that within the next couple of minutes. So, as I said, we in epidemiology we deal with the distribution of the disease, of all diseases. Okay, what is the distribution? It's a rate, okay, or frequency, okay, of the disease. What we actually meant are the frequencies. So we have a numerator and denominator. Okay, and we divide one by the other. So we use on routine basis in epidemiology three rates: incidence rate, prevalence rate, and attack rate. So what is incidence rate? It's a number of new cases divided the number of people, right? So the incidence rate tells us whether or how, what is the pattern of progressing that disease. Is it progressing rapidly or not so much? Okay, and that's especially important for infectious diseases. Well, the prevalence rate is a number of all cases divided by the number of people. Okay, so all cases means the new cases plus the existing cases. So the prevalence rate is used to understand what is the total burden of disease. And we also use, on certain occasions, attack rate. It looks like an incidence rate. And how we calculate that? We take the number of new cases, but instead of dividing it by the total number of people or the size of the population, we divide that by the number of people at risk. Okay, those who, for instance, if you're talking about infectious diseases, those who've been the contacts. Okay, like let me make it more straightforward. Like in case of COVID-19 pandemic, you remember the government's been making their decisions based on attack rates, whether to open up the restaurants and other public places, and universities are closed, keep them closed down. And that tells us how aggressive a particular disease is. So again, we have incidence rate, prevalence rate, and attack rate. That's simple. Well, when I was a medical student long ago, I mean, we also already had on our curriculum epidemiology. I don't know whether it was not taught properly or the textbook was not adequate, but we all hated that because it looked like a kind of mathematics, which was not, it didn't seem that essential to our purposes. But it's quite simple. And the good news is that we use these rates to make our decisions in health sector. But these three rates going to be absolutely useless if we do not indicate three things: person, place, time. Like PPT, easy to remember. What I mean, if I'm saying, let's say, the incidence rate of tuberculosis is 10%, the question is, in which population? Am I talking about people from 0 to 10 years? Am I talking about retired people? Am I talking about men, about women, and so on and so forth? In other words, saying 10% is the incidence rate of tuberculosis doesn't give me any value unless I indicate the kind of the group of population. So that stands for first P. Place, where? Am I talking about the United States or France or Italy or a particular city, for instance, city of Atlanta, or the world? So without saying that, again, it loses its value. It's useless. And time. We need to indicate time. Is it yesterday, 2 weeks ago, 50 years ago, 100 years ago? So normally we most of the time use the 1 year intervals, okay? So therefore, person, place, time is very important. Otherwise, it doesn't really make any sense to collect all this statistical information. Well, we also look at the distribution of other things except the distribution of diseases, distribution of determinants, and what these determinants are and how prevalent they are in the environment. So these are physical, biological, social, cultural determinants, and most importantly, the behavioral factors. Later on in one of my future videos, I'm going to talk about that as well, like especially the behavioral component of it. And we also look at the health-related states and events, like I spoke already about diseases, the causes of death, and again about the risk factors like behaviors like tobacco smoking, and also compliance with the preventive programs and provision and use of health services. Now, here are a few very important uh, elements, or I would say the goals and methods of epidemiology. I'm going to go one by one. There are two big goals, not that difficult to remember. To eliminate and reduce health problems and their consequences, that's one goal. And second one, to prevent their occurrence and reoccurrence. That's simple. Just two big overarching goals. How about the methods? What kind of methods do we use in order to achieve those goals? Describe the distribution and size of disease problems in human populations. That's one. Identify etiological factors in the pathogenesis or of the disease, or simply speaking, to find out, well, what causes that particular disease, and provide data essential for planning, implementation, and assessment of services for prevention, control, and treatment. Okay, these are the three major methods of epidemiology. Okay, we spoke about, I would say, basics of epidemiology and how the knowledge of this, of the value of epidemiology is important. Let me give you one example. Imagine you're short of money, you are in the government, you're responsible for health sector, you're short of money, and for that particular bulk amount, you can implement only one intervention, and you have two options. The one is increasing, vaccine coverage or making vaccines available to more people, and the other one is pediatric cardiac surgery. You cannot actually finance both. You either finance one or the other. Which one will you finance when you're short of money? The one which actually saves more lives, and that is vaccines. And finally, for today, I'm going to show you this picture with the same basic question: what is public health? Well, most probably you recognize these items in the center of the picture, and that is iceberg. And I'm having my own story about icebergs. Well, that happened to me when I was ambassador of Georgia to Canada, and I was attending a very nice business opportunities conference in St. John's, which is in Labrador, Newfoundland and Labrador. And right in the middle of the conference, someone came to the conference room and whispered something to the one who was like leading the conference. And the gentleman stood up and said, "Why don't you follow me? I'm going to show you something which normally, appears here in the month of May, but now we're fortunate to have that in April." And he didn't tell us what. And we all walked towards the Atlantic, coast there, and we saw just a small hill, and we climbed that hill, and that's what I have seen there. So what we see there are three very nice looking icebergs: the big guy, the middle-sized guy, and the small guy. And normally many scientists, whenever they want to describe how complex the problem is, they compare it with the iceberg. So the tip of the iceberg is on a small portion of the entire body of iceberg, and which applies to these three icebergs here. But there is other implication in this picture. If you look closely to that picture, you'll find out that these three guys, the big guy, middle-sized guy, and the small guy, represent exactly the same thing. They are connected under the water. In other words, they have the common, basement background down there. And that's literally about public health, because we encounter in our daily practice many situations when we think that the two or three different problems are not connected, and we deal with them separately, while in reality they are connected. So that was it for today. Let me wish you a very, very nice week. So I will see you very, very soon, probably in a week or so. Thank you.